60 to 70% of women in Canada and in many other countries start breastfeeding. Everyone knows that breastfeeding is the best way for nutrition for a baby. But very often you may need a medication when you do so, because of an infection, because of a chronic condition you may have, because of pain that you endured during giving birth. And many women are very afraid of giving a child milk that have a medication in it, because everything circulating in you will go to some extent on also to milk. So the first message I want to convey is that most medications that you may take go into milk in very small amounts. So small that actually they will not affect your baby. And that should not be typically a reason to discontinue breastfeeding. The list of drugs which may affect the baby through breastfeeding is very small. I will mention a few, but you may always want to check with your physician, of course, or call Mother Risk in Toronto. That will have the answer for you. A drug that is used quite rarely now by adults is phenobarbital. There are some migraine medications that have barbital in them. This drug goes into milk in larger amount than the regular. Another drug quite rare for cardiac arrhythmias is called amiodarone. And amiodarone for some reason goes a lot into milk. And again, one has to think whether it's healthy to breastfeed. A relatively new discovery is that the drug codeine, which of course is part of Tylenol 3 and similar products, taken by many women after cesarean section and after episiotomy, after being cut during labor, may go in some babies much extent into milk. And the reason is because mama produces from that drug more morphine than the next woman on the block. This genetic variability may be of a problem. So now people give less and less codeine during breastfeeding. Otherwise, if you really want to breastfeed and it fits your lifestyle, there's no reason for you not to breastfeed. Do it, of course, in advice with your physician, but the general thought that you need to stop the medication or not treat yourself are both, in most cases, are not warranted.